Hey everybody, Dr. Amar here, wanting to review with you how to perform these post-frenectomy stretches. So let's take a look. Let's start with why we do these stretches. Anytime the body undergoes some kind of injury or trauma, the body has a natural desire to try and repair things to where they were prior to that injury. So in the case of a frenectomy, if there's problematic tissue that's preventing a lip or a tongue from functioning properly, and we remove that tissue, whether it be with a laser or a scalpel or a scissor, the body is going to try and reattach those tissues back to where it was prior to the frenectomy. By performing these stretches, you are essentially removing the cells that are rushing to that area, trying to reattach those tissues back together. The goal is to try and have two independent structures that can now move separately from the tissues that they were once adhered to. Because the majority of healing takes place over those first couple of days and weeks, we really place a strong emphasis on stretching very frequently for those first couple of weeks. For that reason, we usually recommend pairing stretching with the feeding. If we do that, we know that we'll hit an adequate number of stretches to hopefully prevent that problematic reattachment. When getting ready to perform the stretches, you want to be positioned behind your child with your child's head facing you. I usually recommend using your index fingers because we tend to have the most dexterity in these two fingers. You're going to use firm but gentle pressure, and you really only need to be in there for a few seconds, about 5 to 10 seconds per stretch. I'm going to want you to stretch every 3 hours for the first week, every 4 hours for the next week, every 5 hours for week 3, and lastly, every 6 hours for that final week. Now, if after week 4 you're still seeing some white and yellow tissue up in the area, that means that there is still some active healing, and you can still stretch, even just a few times a day should help, but the majority of patients should be done healing after that week 4. Because we want you to stretch very frequently, I usually recommend just pairing the feedings with the stretches. That way we know we're hitting the amount that we need to. A question I get commonly is, am I supposed to wake my child up to stretch? This is a controversial topic amongst release providers. Some are, adamant that they need to be stretched every 3 hours. Some, like myself, feel that sleep is very important for a developing and growing baby. So I'm not a big proponent of waking a child up to do stretches. However, when they do wake up to feed because they're upset, whatever it is, go ahead and do that stretch during that time. So that's where that's my opinion on the matter. There are, again, conflicting opinions there. I just feel like the amount of stretching, as long as you're doing what you should be doing while the child is awake, and every 3 hours as much as you can while they're awake, you should be able to hit the amount that we want you to get to. When doing the lip stretch, I want you to start with your fingers at the corners of the mouth and move them forward towards the site of the frenectomy. You need to be able to see that full diamond in order to know that you're getting that full stretch. You can also rub your finger on that site so that you can clear away those cells that are rushing to that area. Notice how it looks like we're stretching the lip up over the nose. That's how I want you to do it. I know it's aggressive and I know it's tough, but that's the only way to make sure that we're getting that full stretch. Again, a little rub is just fine, just like that, but make sure you're getting that full stretch up there. As you can see, it really doesn't take a lot of time, just 5 to 10 seconds, big stretch, rub, big stretch, rub, big stretch, rub, and you're in there. When doing the tongue stretches, you want to get your fingers right next to the site of the frenectomy and pull that tongue back, almost like you're pulling it into the back of the throat. When you're doing that, you're going to be able to see that full diamond again, just like you see here. Now you're going to notice towards the right of the frenectomy site, you'll see a couple drops of blood. That's okay. It's still very normal for the site to bleed shortly after the frenectomy is done. Again, just a few seconds at a time, just make sure that that tongue is stretched as high as it will go. You want to make sure that that tongue has the full amount of mobility that it did the moment that the frenectomy procedure was done. So don't be afraid to try and get that tongue to hit the top of the mouth. And you can also rub that tissue again just to make sure that we're wiping away those cells that are rushing to those areas to try and reattach them. Just some final points regarding these stretches. I am totally aware of how much these stretches are not fun. You are not going to enjoy doing them. Your baby's going to cry while you're doing them. Unfortunately, they are just so crucial to the success of the treatment. So please, please, please make sure that you are committing to doing these stretches. Again, we're looking for just firm but gentle pressure. We're going to want to stretch for just 5 to 10 seconds at a time. You don't need to be in there for minutes at a time. Just 5 to 10 seconds, and then put the child on the breast of the bottle, and they will calm down rather quickly. Again, when you're stretching, you just want to see that full diamond. So if you're not seeing that full diamond, it means that you're not getting a full stretch in there. So like I said, for the upper lip, you're going to want to stretch that lip up into the nose, stay at the base of the lip so you can visualize that full diamond. Same thing with the tongue. Lift that tongue up and back, almost like you're pulling into your belly button. Again, as long as you're seeing that full diamond, that's all that matters. If you want to stretch by using a rolling pin method or stretching the tissues up and down, rubbing them, that's fine. As long as you're visualizing that full diamond, that's all that matters. And that should be it for the stretches. You should receive a text message from me shortly with a link to this video, so you should be able to reflect back in case you have any questions or missed something. And we'll look forward to seeing you in about a week to see how things are improving. Please feel free to text me on that number that I'm going to text you from if you have any questions or concerns. The main thing to remember is that we are going to be a little bit sore and uncomfortable for about 36 to 48 hours. We're going to review the Tylenol and aftercare instructions with you momentarily. But if you have any questions or issues, please feel free to give me a shout on that number. Well, we're wishing you the best of luck and can't wait to see you guys soon. Thanks.